Good morning and hello to everybody who is still watching CIRSE Summit 2021. It was an exciting Congress. Today is the last day, and we have very nice sessions for you. We prepared topics from many different subjects, and we have three distinguished guests with us today to talk about today's program. Today we have Professor Patrick Hage, Professor Mohammadi, and Professor Raman Uberoy, who will discuss today's program. So, Patrick, which is your favorites for today?
Well, good morning, Adam.
Good morning.
Yeah, this is going to be a tough day for the attendees, actually, because there's such a great program for the last day that you have to really decide on what to do. And if this was like an in-person meeting, I would probably go to the Rush auditorium, because there's very good sessions there, especially in the afternoon. And my personal favorite is the dialysis access session. There will be the moderators will be Ziv Haskell and Scott Treotola. So those are the protagonists of dialysis access for, I don't know, more than 20 years now, and I think they'll be leading the session very well. And we'll see what's new in dialysis access. What about are there new data on treatment, on balloon angioplasty, when to stent, when not, which kind of stents to use. And 2 years ago, there were the new KDOQI guidelines published. So what's going to be the new guidelines? Is there anything new in that? So that should be a really, really good session. And I'd recommend everyone to go there. Yeah.
Great. What else?
What else? Pulmonary embolism. Also something, it's a mixture actually of diagnostic and interventional things that should be interesting for the hybrid colleagues of us also. So what's the imaging? What are the guidelines right now? What is the treatment? Now, is it more medical? What can the interventional radiologist do in cases of pulmonary embolism? And what is in light of COVID-19? Are there changes? Is there anything new that we have to look at? That should also be something we will be discussing, because we know that there's a higher incidence of pulmonary embolism in COVID patients, and that treatment has to be modified according to that. So that should also be something worth looking at.
Fine. I think there is also a very nice session about prostate embolization.
Exactly. You know that embolization is also something that interests me very much. Just hinting at next year's ET Congress,
which will be... As a doctor, but not as a patient, I hope.
Well, hopefully not. Yes, exactly.
Especially for the prostate.
Now you interrupted me, because I wanted to say, the ET in June, of course, featured by CIRSE in Nice. So you all be there, and there will be a lot more on prostate embolization. But yeah, there's a workshop on prostate embolization this afternoon also. And hopefully you'll hear a little bit more on how they do it, especially anatomy. I think this is a crucial point. I always have to listen to the anatomy every time again, because it's quite complex sometimes.
Do you think there is some progress made regarding the data we have in our hands now to convince urologists about the usefulness of embolization?
I think the database is pretty good already, and we are now reinforcing that. The problem is, and I think this is more or less a national or international problem in Germany, for instance, to convince the urologists to give up one of their favorite fields, right? And if you're able to do that, you need to do data, but you have to be able to show what you can do. So you need to get a patient and then treat him, and then afterwards the urologist will say, okay, maybe there's an indication for me to pass on the patient to you.
Great, thank you. Thank you very much. So now I will ask my friend Mohammadi about who is responsible for the Aortic Program. And I am sure he has some very important sessions today to discuss with us.
So thanks, Adam. There are several areas of the program, some of them related to ideas and some of them related to the general IR. In the morning, one of these sessions, the challenges facing IR. I mean, we all know that interventional radiology is a very successful specialty. It's based on innovation and advancing technology, and there is no limits, and continues to grow and attract attention. But that comes with a big price, and the price is that we have a lot of pressures and challenges from different angles, from within and from outside the IR community. And this session will address at least some of those challenges, the workforce and the how to interact with other specialties and the training issues. And I think, and some solutions will be discussed, how to go forward and continue that momentum of success. So, very recommended session. And also I'd encourage the audience to submit questions and engage in the discussion.
I think in this year's program we show that we have a very good relationship also with the vascular surgeons, because we have many of them in our program, and we want to show that we should cooperate, and all together we can get the best result for the patient.
That's right. And the collaboration is a key thing. Especially when you collaborate at equal standing and you know an mutual respect and putting the patient at the center of care and attention.
I think this point is very important, because today we have a couple of sessions about challenges facing IR. So this, let's say, political or such kind of turf fights, battles are in the daily program for us. And what do you think about this?
Yeah, I mean, that's a human being, but always the interaction is not easy. Human is not an easy
animal.
No, but the key thing is we should stay away from the turf. We should stay professional. We should stay honest to our patients, and we should stay honest to our trainees and focus on ourselves, how to get better. And if we get better, people will respect us and we'll go forward. The other sessions, it's from the ideas, there is a workshop on EVAR, and this will be an extremely good workshop. It will address all aspects of the procedure, and they all benefit from it, whether junior person or even experienced one. We have a very interesting session, which is the video recorded cases. Yes. And
these are about aortic problems.
Aortic problems, and those video recorded cases, each one has so many things in it. The expert will be talking about new technology, how to handle the equipment, and some tips and tricks. And I mean, I'm cheating a bit because I've watched all those videos, and I mean, I'm more than happy to watch them again and again because they're so good ones. The final thing is I'm looking forward to it, is the controversies in radial access. A couple of days ago, there was a very good workshop by experts. It was very well attended. So people now know how to do radial access, but what we need to know exactly where to use it, because there's no size fits for all. So we need to know where to use it and where not to use it. And that controversy session will cover that.
Great. Thank you very much, Mo. Now I move to my friend Raman, and he would like to tell us what's his favorites for today.
Well, thanks, Adam. It is a jam-packed program, so there's a lot of choice. And as Patrick and Mo have already alluded to, there's some really excellent sessions, and they've covered some of them. But I'm personally looking forward to some of the things we can learn from this awful COVID pandemic. This has been a terrible saga for the world, and it has really impacted on interventional radiology, along with other specialties, but it's really how we've adapted, how we've developed our working practices, what we've learned for now, but also for the future, because sadly, COVID has not gone away. It's still rumbling on in the background, and in third world countries, it is still on the rise. So it's also really important for them. And then for our own future, we need to think about when the next one comes along. We need to be better prepared. We need to have our systems in place, how we deal with the next set of pandemics. So this is going to be a really important session, and I would certainly be sitting, watching this, learning and developing so that I can then plan for my department and my colleagues, and hopefully we can share this across the world. So that's a really important session.
I think worldwide, the interventional radiologists did a fine job with COVID patients because nobody knew about the complications we could have, and especially bleedings, which occurred everywhere in the body. Interventional radiologists were forced to deal with that, and I think we did a very good job.
Interventional radiologists were right at the forefront of caring for patients. They were right at the front line dealing with these really difficult patients, sometimes putting themselves at risk of harm and death. So it is something that IR should be proud of, because we were very proactive, we were very effective in helping patients get better, save lives, and also support all our clinical teams who all pulled together. And that was a really positive thing, is that all the clinicians were working very closely to make things better.
Exactly, this is the critical word, clinicians, and we showed through this pandemic that we are dedicated to the patients. We are not afraid to deal with such problems, and we are right in the clinical practice in the front line. What else for today?
So for my own personal interests, I have a big interest in aortic work, of course, and there's the controversy session in the inferior aorta. That's a really important session because it talks about, what is the optimal way to deal with these patients? Should we be looking at the neck more critically as to should we be using those advanced techniques and trying to deal with them everything inferiorly, or should we be moving up into the aorta? Should we be doing chimneys? Should we be doing fenestrated? Should we be doing arch programs? What is going to give the patient the best results? And it's not always clear. Sometimes we do things because we have no alternatives, but sometimes we should try and do what is the optimal for the patient. And occasions, that may be to do nothing at all, which is quite difficult. And that's something we find very hard. We're faced with a patient, and we think we have to treat them. And maybe sometimes the best thing is not to do something. So these are really important discussion points and debates that we need to have internally. Just because you can do something, you shouldn't. But there are some really good techniques out there that we can utilize and really get good outcomes for these patients. So I'm looking forward to the interplay and the discussions, and this is a session I think I'm going to really learn from. Alongside that, moving along to the sort of dissections and across, looking at the chronic disease. What do we do for these patients? This is something we're facing, regularly. What are we going to do with these guys? Because
I think it's going to be a very, very interesting discussion about all these problems. But we still have some other sessions like the lymphatics. This is a topic which other specialties cannot help a lot, and suddenly interventional radiology can do something. What about that?
And that's a really interesting development. I mean, we've been dealing with lymphatics for years, and there are centers who really specialize in this, but it's now obvious that many centers can undertake these procedures. We get a lot of patients who end up with leaks or complications following major thoracic surgery in particular, and they end up with long-term leaks. When medical therapy fails, what do we do? And there are some really good techniques now, which are, for a good interventional radiologist, not so difficult to learn and develop. And certainly, puncturing the cisterna chyli, getting access from the subclavian if necessary, getting nodal lymphangiography. These are all really important steps in diagnosis, managing and treating these patients. And so again, this is a really good session, and I would urge people to come and watch this because it's something that we can do without too much difficulty. We have the skill sets and we can deal with these patients, and they're very grateful because it avoids major surgery, because that's the alternative. They have to undergo
really
repeat surgery.
It's very exciting that interventional radiology can expand in so many different clinical problems and give solutions.
And as Mo's highlighted, we are ever expanding, we are developing new techniques, we are really breaking new ground and developing new frontiers. And that's one of the strengths of innovations that IRs can do. But again, as Mo has highlighted, we need to develop our professional practice and clinical aspects alongside it, so that we are doing these procedures and sharing them and sending them out to our trainees and our future interventional radiologists, so that they have a good working practice and good working life in the future.
Thank you very much for this. There are still a couple of sessions, another sessions we didn't discuss. They are all recommended, of course. One is about renal cancer and treatment options. And there's another one, very interesting, I think, about pain management. Pain management is a hot spot, I think, because most of the people have pain somewhere. So if we can help them, if it's pain management for ischemic legs, for example, or a hypogastric nerve for UFE, or even there are some topics about peri and post-procedural pain in IR in general, as well as hepatic nerve block for before thermoablation, which are new and very useful for interventional radiologists to know. So the day is full of information. I hope you enjoy it. Thank you all very much for this early morning meeting, and I hope everybody enjoys the final day of CIRSE. Have a nice day.
Thanks, Adam.
Thank you.